Hi, Dr. Baumholtz. You know, I get asked about tummy tucks pretty regularly, and one of the most common questions I get asked is, can I just have liposuction, or can something be done more minimally invasive, or what's a mini tummy tuck? I will often joke that if you ever want a mini result of anything, be sure the operation starts with mini something. You want a mini resulted abdominal procedure, get a mini tummy tuck. I'll talk about why that is in just a minute. That's my sense of humor. In the meantime, let's talk about, and I'm going to go back to the page here, let's talk about some of the elements of the aesthetic concerns of the abdomen or of the body wall. And they are skin, fat, and muscle. Not everybody has a problem of all three, but a lot of the patients that we see do. And so I will often make the joke that we are nothing more than balloons with emotion. And so, for example, if we suction out or we remove all of the fat by one means or another, well, then that skin's going to sag. There are people that are being told in the community that if they do liposuction, their skin will retract. I suspect in many ways that's magical thinking, because after a certain age and a certain weight, the skin just doesn't retract. But let's talk about how we manage these three elements of the body wall. Fat very simply can be liposuction. Yes, it could also be weight loss. But in terms of a surgical solution, liposuction or even direct excision is a great way to manage the fat. Skin, we really only have one great way to manage it, and that's to cut it out. And so if you've ever done any sort of sewing, you know that to avoid pleating and wrinkles, especially in curved sewing projects, the incision needs to be pretty long, or the cut needs to be pretty long. Muscle, over time, especially following childbirth, the six-pack muscles, which used to be very close to each other, do migrate away, and unfortunately no amount of time in the gym is going to bring those muscles back together. The only thing that's going to bring them back together is a needle and thread, and I'm going to explain that in just a minute, but the muscles will often need a repair to make them better. I see a lot of folks that have had liposuction, they come back, they're still unhappy with their poochiness at the bottom, and that's not because of fat that was left behind, that's just because of the muscle weakness. So let's talk about the body wall, and specifically what it is that we're looking at here. And I'll try to trade colors. So this is a representation of your ribs, and this is your pelvis, and this is your belly button. And so this is your six-pack muscles that started off right next to each other, and then thanks to those children that you have, they've moved apart. And so what we do is in surgery, we take a needle and thread from your breastbone all the way down to your pubic bone, and that helps to pull in the muscles to where they should be. It helps to accentuate the curves of your side as much as your anatomy will allow. So one of the questions that I get asked is, people will bring me pictures of somebody else to say, I want to look like that. And I say, I can make you a better version of you, but I can't make you look like someone else. We are ultimately limited by your anatomy, meaning the relationship between your last rib and the top of your hips determines how much of that hourglass I can give someone with this muscle tightening. Well, that is a basic overview of abdominal cosmetic concerns and then how we approach them and the three main tissue elements. If you'd like to know more, come see me in the office. If this format of instruction works for you, please let me know and we'll keep doing it. If not, we'll find some other way to get our message across. Anyway, have a great day. Thanks so much for listening.